This is Akio. He's healthy now, but there's one common condition he could develop as he gets older, and your cat could too. I'm Jim. I'm a veterinary surgeon with over 20 years of experience, and I'm trying to make videos to help you understand your pet's health without the overwhelm and worry. The condition we're talking about is hyperthyroidism, the most common hormonal disease in cats, and one we often spot too late. Today, Akio is kind of going to help me explain what it is, how to spot it earlier, and the options for keeping your cat feeling their best. Stick with me, it's not as complicated as it sounds, and knowing the signs could help you add years to your cat's life. I've put together a free checklist for monitoring older cats. You'll find the link in the description so you can start using it today. So hyperthyroidism means the thyroid gland, or sometimes both glands, in your cat's neck are producing too much thyroid hormone. These hormones control metabolism, so when there's too much, it's like your cat's body is running on fast forward. It's the most common hormone problem we see in older cats, typically over about 10 years of age. The most common sign we see with hyperthyroidism is weight loss despite eating more. And sometimes they can be eating a lot more. And very often it's that begging for food that owners notice first. And that's because the metabolism is burning through energy faster than they can replace it. You might also notice that they're drinking and urinating more. And this happens again because the hyperthyroidism speeds up the blood flow, and this time in the kidney, which can temporarily hide kidney disease in some blood tests, making the kidneys looking healthier than they really are. Some cats can become restless or even hyperactive, pacing around, vocalizing more, especially at night. And because of that increased metabolic rate, you can find that they get vomiting or diarrhea because their gut's moving food more quickly than it normally would. But not every cat shows every sign. And in early diseases, the changes can be really subtle. That's why I've put together the free older cat health checklist. You can find it in the description, and it helps you pick up on these small changes before they become big problems. So while the history and the symptoms can be really suggestive, there are other possible causes. And when you bring your cat in for a check, your vet will likely start with a thorough physical exam. And sometimes we can feel a small firm swelling in the neck, and that's actually the enlarged thyroid. And if we can, well, whether we can or we can't, we'll still try and confirm that with a blood test. And the most common measure is total T4, which is usually raised in hyperthyroid cats. Uncontrolled hyperthyroidism puts the whole body under strain. The heart can develop what's called a cardiomyopathy. So the heart muscle thickens and it pumps less efficiently, which can lead to a heart failure, fluid in the lungs, breathlessness, or potentially collapse. And the high blood pressure we get can cause sudden blindness if the retinas become detached, and they may also cause seizures or strokes. And we mentioned the kidneys earlier, they're at risk too. So the increased blood flow can mask an underlying kidney disease that once we start to treat, because the blood flow to the kidney drops, will become worse. So without treatment, hyperthyroidism will likely shorten your cat's life. What are our treatment options? Well, the most commonly used is medication, and this blocks the production of the thyroid hormone directly. And it works really quickly, the dose is adjustable, and it's non-invasive. But on the flip side, it does require daily dosing for life, and as with all treatments, there are possible side effects. We're also going to need to check the dose of medication we're giving using blood tests every 3 to 6 months. We can also consider using a radioactive iodine therapy. So in this case, we're using one injection which destroys the abnormal thyroid tissue or sparing the healthy tissue. It's usually curative and it has minimal side effects. We can consider surgery, so a thyroidectomy. And in this case, we're going to be removing the affected gland, and it is potentially curative. But we have the risk of the anesthetic and potential damage to the underlying parathyroid gland as well, which could create another set of problems. And then we can use dietary management. So this prevents the thyroid hormone production by restricting the amount of iodine. It must be fed exclusively, so no treats, no other foods. And unsurprisingly, some cats may refuse it as it can be unpalatable. We're going to need to consider lifelong monitoring. We're going to want to check for recurrence of the disease. If they're on medication, then potentially adjust their dose. We're going to monitor kidney function because, as we said earlier, we could have an underlying kidney disease. And we're going to need to control their blood pressure. But with early detection and the right treatment, most cats live for many happy years. So why not consider downloading my free older cat health checklist from the description? It's an easy way to track weight, appetite, thirst, and behaviour. Cats can be great at hiding illness, but spotting changes early is one of the best gifts we can give them. So remember, weight loss in older cats isn't always just ageing. Hyperthyroidism is common, serious, but we can treat it. And if a cat is showing any of the signs I've mentioned, book a checkup with your vet. Thanks for watching, and give your cat a cuddle from me and from Accio.